Bloodborne Pathogens, Part 1. Objectives: to understand the following: the types of bloodborne pathogens, occupational exposure, and causes and modes of transmission of bloodborne pathogens. Introduction. 29 CFR, or Code of Federal Regulations, 1910.1030 is the bloodborne pathogen standard, and it was enacted in 1991. Bloodborne pathogens are pathogenic microorganisms such as viruses and bacteria. Bloodborne pathogens are found in human blood and other potentially infectious materials such as OPIM. If you have any questions regarding bloodborne pathogens, please contact David Farrell, TRIASIM Safety Director at dfarrell@triasim.com. OPIM, other potentially infectious materials. Some bodily fluids that are OPIM include semen, vaginal secretions, amniotic fluid, and others that are listed in the regulation. Saliva and dental procedures. Any body fluid that is visibly contaminated with blood. All body fluids where it's difficult to differentiate between body fluids. OPIM does not include feces, urine, vomit, or ordinary saliva unless visibly contaminated with blood. Safety and health risks. Blood and OPIM can carry pathogenic microorganisms that can cause hepatitis B, hepatitis C, human immunodeficiency virus or HIV, or the acquired immunodeficiency syndrome, which is known as AIDS, and it also can cause other diseases. It is important that you understand the dangers. As a first aid provider, it is critical to your role. Occupational exposure. For first aid providers, occupational exposure includes reasonably anticipated skin, eye, mucous membrane, or contact with blood or OPIM that may result from the performance of an employee's duties. There are protections and training that's required for employees with occupational exposure. Note, Good Samaritans are not included as part of occupational exposure. Causes and modes of transmission. Exposure can be divided into two subgroups: direct, which is person-to-person contact that may occur when a first aid provider contacts a person, and indirect, which is contacting an object such as blood-soaked clothing. Hepatitis. Hepatitis transmits through direct and indirect contact. It can affect the liver. Its causes can be due to toxins, certain drugs, diseases, heavy alcohol use, and bacterial and viral infections. And the two most common types are hepatitis B and hepatitis C. The hepatitis B virus. It ranges in severity. It transmits when infected blood or certain other body fluids enter the body of a non-infected person. Employee exposure occurs when needles, syringes, or other drug injection equipment are shared. Items such as razors are shared with an infected person. Direct contact with the blood, even dried blood spills or open sores, and exposure to blood from needle sticks or other sharp instruments. Hepatitis C virus. The virus spreads through direct contact with infected blood. It can cause serious health problems. It is a leading cause of liver cancer. It is not transmitted efficiently through occupational exposure. Transmission methods do include blood transfusions and organ transplants, sharing needles or other equipment to inject drugs, body piercing or tattoos in unlicensed or informal facilities, blood contamination, sexual transmission in rare cases, and childbirth. The CDC, or the Centers for Disease Control, says HCV, which is the hepatitis C virus, is not spread routinely through casual or mouth-to-mouth contact, hugging, sneezing, coughing, sharing food, sharing eating utensils, or sharing drinking containers. Human immunodeficiency virus. This spreads through direct and indirect contact with an HIV positive person, can lead to AIDS, and there are two types, HIV-1 and HIV-2, and these destroy blood cells that help the body fight diseases. Transmission methods include unprotected sex with someone who has HIV, sharing needles, syringes, rinse water, or other equipment used to prepare illicit drugs for injection, and birth to an infected mother. HIV can be passed from mother to child during pregnancy, birth, or breastfeeding. HIV. There are less common transmissions in the workplace, and they include being stuck with an HIV-contaminated needle or other sharp object, being bitten and the skin is broken, and then contact between broken skin, wounds, or mucous membranes and an HIV-infected blood or blood-contaminated body fluids. The CDC says HIV cannot spread by air or water, insects including mosquitoes, ordinary saliva, tears, or sweat, casual contact like shaking hands or sharing dishes, and closed mouth contact. Other diseases caused by bloodborne pathogens include malaria, syphilis, and many others. I would suggest that you visit the cdc.gov to learn about causes and modes of transmission.